It would be nice to imagine that my field of psychiatry is nothing but careful science. And while that's mostly true, despite what some of you skeptics might think, it's also a field that has its share of fads and trends. In my last video, I mentioned one particular fad that I'll go over again here along with several others. Frankly, the situation's getting worse, with social media amplifying buzzwords and popular diagnostic labels way out of proportion to their actual value. That's our topic today, so stay tuned. I'm Dr. Stephen Reidbord, a longtime psychiatrist and psychiatric educator. If you like what I'm doing here, please like this video and subscribe to More Than Meds. Fads come and go in all fields, including very strict scientific ones. For example, I was very into chaos theory back when it was popular around 1990. Yes, I know that before you were born, maybe. I even published a couple of papers about its application in psychiatry. But it turned out to be a fad in biology and even in physics, hard science, physics. Chaos theory still exists, of course. There's still scientists doing experiments, papers being written about it, and so on, but it's lost its pizzazz. It's no longer in the news. It's no longer in the public imagination. Likewise, transcendental meditation, chelation therapy, thigh masters, crash diets, you name it. Psychiatry and mental health care generally has had its share of ideas and practices that suddenly became very popular, and then they came and went. Some of these were old treatments like lobotomies, brain surgery, and insulin shock treatment. And they were replaced when it was found that they didn't work, or that they were cruel, or we had better replacements. Science marches on, but I'm not talking about that today. Instead, what causes a particular diagnosis, a particular way of looking at patients that was already out there in the world? It was a diagnosis that was already known, already described, but that it suddenly became popular. It was on everybody's mind. It was discussed widely, but only for a short time, and then it went away. What causes that to happen? I'll get to some fairly recent fads shortly, but I want to make the point first that none of this is new. Back in the late 1800s, two terms, hysteria and neurasthenia, were fad diagnoses. They were catch-alls applied widely and indiscriminately. Hysteria, as you may know, was named after the idea that a wandering uterus was the cause of various emotional problems in women. It was nonspecific and, of course, completely unscientific. I have a clue for you. The uterus can't wander. It's attached in there. And the whole idea was basically sexist. It equated having a uterus, that being female, with mental weakness and disability. Neurasthenia was a fancy term for mental exhaustion, a kind of catch-all, non-specific explanation for fatigue and anxiety and various bodily or somatic complaints. The point isn't just that these were unsupported by science. They also reinforced cultural stereotypes and became part of the common language in everyday conversation. Something about them captured popular interest. That's why they became fad diagnoses. Can you guess what some of those factors were that led to that? First, they're vague. They explain everything and therefore nothing. Fatigue or mental weakness occurs to all of us a lot of the time. Wouldn't it be nice to have a medical, technical sounding name that seems to explain that? Hey, I'm not being lazy, I just have neurasthenia. And as mentioned, hysteria could reinforce or even extend sexual stereotypes. Men in the late 1800s could degrade women by calling them hysterical or hysterics. Second, these terms were promoted by charismatic, influential people. Back then they were called doctors. If highly educated, dignified doctors use these terms, they must be valid, right? And the third factor was media. Media was far more basic in the 1800s, but Newspapers and magazines made regular reference to hysteria, neurasthenia, such that they became part of everyday language. So keep that in mind. First, these are vague descriptions. Second, they're promoted by influential people. And third, it's amplified by media. Let's fast forward to the mid-20th century. As I mentioned in my last video, multiple personalities or multiple personality disorder caught the public's attention. In part, this was sparked by books, starting in the 1950s actually, with a novel called The Nest, later made into a movie called Lizzie. Then Three Faces of Eve, written by two psychiatrists about a real patient. Three Faces of Eve was soon turned into a popular movie starring Joanne Woodward, who actually won an Academy Award for Best Actress for playing that part. Later, in 1973, the book Sybil introduced the public to a patient with 16 personalities. This was a nonfiction book. And the book, in turn, was made into a made-for-TV movie in 1976. Many say that Sybil, the book and the movie, popularized the notion of multiple personality disorder and also the idea that a patient with that disorder might not just have 2 or 3 personalities, but a large number. It was fascinating and weird, and it captured the public's imagination. When I was a psychiatry resident in the latter part of the 1980s, multiple personality disorder was everywhere. Some patients seemed proud of the number of different personalities or alters that they had. They'd list and categorize them. Specialists in multiple personalities opened clinics specifically for this, and they encouraged the patients to name more and more of these alters within themselves, more and more personalities. This was counterproductive and harmful. It was an unhelpful fad that thankfully died out. Multiple personality disorder is now called dissociative identity disorder, DID, and we now recognize that it's fairly rare. The goal of psychotherapy is not to multiply the number of personalities, but to do the opposite, to help a person unify their sense of self, to own all the contradictory, warded off parts of the self. This public fascination with scary, complex, hidden parts of our psyche also fueled popular movies like the 1960 Alfred Hitchcock film Psycho, or the 1962 film The Manchurian Candidate, about a politician who was secretly brainwashed. Some of this might have been the public's fear of psychoanalysis and the way psychoanalysis threatened to uncover scary, unwanted parts of the psyche that weren't apparent to everyday people. This notion of scary, hidden material in the unconscious culminated in the 1980s in a fad regarding repressed memories, by that point called recovered memories. Although repressed memories had been recognized as a possibility in trauma from before the time of Freud, actually, suddenly therapists in the 1980s reported this skyrocketing number of recovered memories of childhood abuse. These were far-fetched accusations, including reports of ritualized satanic abuse. That is, reports that the patient now could remember scenes of torture or witnessed murders done by satanic cults. Thing is, none of that really ever happened. For a time, our field had big debates about the validity of recovered memories. Defenders believed the children, while critics claimed that the therapists themselves were so fascinated by these reports that they unwittingly encouraged them in the patients, and the patients complied. They manufactured these memories because it pleased their therapists. Eventually, given that many of these so-called recovered memories were demonstrably false, the fad faded away. As we turn to the 1990s and beyond, we start to talk about fads that are still with us. The 1990s saw a sharp rise in the diagnosis of bipolar disorder in young children. If a kid was too emotional or jumpy, maybe they had a form of bipolar disorder, manic depression, and would benefit by getting a medication to smooth their mood out. Given the side effects of such medications, the fad, thankfully, faded out in the early 2000s. Since the symptoms of many psychiatric diagnoses overlap with those of other psychiatric diagnoses, it's kind of easy for a fad to arise to assign these nonspecific symptoms to one label or another. A prime example of this is ADHD. The ADHD boom began in the 1990s and continues to this day. Inattention, restlessness, and impulsive behavior have a lot of different possible causes. ADHD is a real thing. It exists separately from other psychiatric diagnoses. But it's become the go-to term, the explanation for these nonspecific symptoms. Why? Well, remember those three things I mentioned. First, it's vague. It explains everything and nothing. Number two, it's popularized by charismatic influencers, celebrities. And number three, it's everywhere in the media that people watch hours every day. Social media, TV talk shows, you name it. Like hysteria and neurasthenia, ADHD as a label far outstrips its usefulness as a medical term. Likewise, autism spectrum disorder. Autism used to refer to severely disabled patients, many of whom couldn't interact at all socially or even speak sometimes. Then we invented a milder category called Asperger's syndrome. And then we folded Asperger's into autism to create autism spectrum disorder, or ASD. So now we have a fad where people who are a little socially awkward or introverted are considered, quote, on the spectrum. Debates rage over whether ASD is a neurological disorder, or maybe it's a normal variant. It shouldn't be considered a disorder at all. Maybe it's something else. That discussion is premature when we're in an age where anybody can call themselves or other people on the spectrum based on some influencer's TikTok. Take my word, it's a fad. It's not going to last. 5 or 10 years from now, being on the spectrum is a term or phrase that's either going to have faded away, or possibly the definition will be much more precise and tighter, in much the same way that dissociative identity disorder still exists, but it's not this popular multiple personality craze that it once was. It won't be a popular fad. It'll be interesting to look at this video 5 or 10 years from now, if it's still around, see whether I was right. And now, of course, there's ADHD, the combination of autism and ADHD, 2 fads in one. I predict that's even less likely to last. There are other modern diagnostic or labeling fads that I won't go into detail to talk about here. If you're on social media, and you all are, you're already aware of a lot of these. The overuse of narcissism, or borderline personality, or sociopath. The way that every setback or disappointment is trauma. In all of these examples, vaguely used terms are promoted by charismatic, influential people and then amplified in media. Unfortunately, many of these words, like narcissism and borderline personality, also have precise technical meanings, and those meanings get lost in the hype. The risks of fad diagnosing are many. Overdiagnosis can lead to iatrogenic harm. Iatrogenic means harm caused by doctors. For example, medication side effects, or if a surgeon damages something while doing surgery. There are opportunity costs in pursuing a diagnosis that doesn't really help. It can delay treatment, the right kind of treatment. And then there's stigma. Although a lot of people wear these labels proudly, it's not good for any of us to identify ourselves primarily with one or more medical labels. Each of us is a lot more than that. Battling fads in psychiatric diagnosis is a job for professionals like me. Controlled research, long-term outcome studies, careful tracking of side effects, and strict diagnostic thresholds. But there's an important role for the public, too. Please resist the reflex to diagnose yourself or others based on social media content. Despite what you might think, it's not the best way to be supportive or helpful for a friend or relative in distress. In fact, I did a whole video on that, which I hope you'll look at right there. Let me know what you think in the comments, and please like this video and subscribe to my channel. Thanks, and I'll see you next time.